Well, welcome back to continue our discussion talking about St. Francis Hospice and Hospice Care. Joining me is Alan McBroom, chaplain. Welcome to the program.
Thank you.
Now, your focus is on the spiritual component. Now, before I kind of get into what that really looks like in general, you have people of all different faiths, and sometimes
Yes.
people are very concerned that if I'm of this faith, but maybe this institution or these caregivers are not, I'm going to feel obligated to either not practice my faith, express it, or acclimate to what they want. Clarify for us, how do you deal with people of different faiths?
Well, we serve a wide variety of faiths, and so we're very ecumenical in how we approach people. We meet them where they are in their religious beliefs and serve them as best we can. Most of the time, there's no problem. If, however, they want somebody from their faith specifically, most of the time they have someone from their church or synagogue, and so we can already have those needs met. We don't seek to replace their pastor. We seek to be an additional support to as in addition to their pastor.
Okay. So if they had sort of special needs, even in terms of food or certain rituals that they needed to practice, that's something that's easily incorporated?
Oh, absolutely. And like I said, most of the time, if that's the case, then they'll have someone from their church background, their religious background, help them with that. I serve the sacrament. I serve anything that people find comfort in their religious faith background. And so our chaplains are able to help people from a variety of backgrounds really get meaning and comfort and spiritual care from their faith.
Okay, now Sydnie mentioned in terms of the health arena that, and clarified that they're going into the homes, that it's not very frequent that people are put in a sort of a hospital type setting. The chaplain, do you operate the same way? You're going into homes, or do you have a separate service someplace else that people need to attend? How does that work?
Yes, most of the time we go where the patient is, whether that be in the hospital. Most of the time it's in their home or some other nursing home, for example. We go and meet the patient and the families. If they request a visit as well, we can meet with them jointly or separately. And we have a separate service you mentioned. Usually that's done once or twice a year as a memorial service where we have the families come in. But most of the time, chaplains will go to the patient, into the patient's home, and have prayer, have a service with them.
Okay, now you said you incorporate the family as well into this, so if they're wanting to have more of a, let's say, more of a church service, I mean, is it like a full-scale service? Let's say if the person is, and I'm just going to focus at this point on the Christian faith, although there are many, many others.
Right.
But let's say the person is accustomed to going to, let's say, a Baptist church, and they're accustomed to having, you know, more of the religious music, which is uplifting for them, and an actual teaching type of sermon. Do you get to that extent, or do you do something a little more abbreviated?
Most of the time it's not a full-blown service. It is abbreviated. A lot of times people will have music on tape or CD there, and a lot of times we will pray and teach with them and remind them some of the biblical truths that they've grown up with. And a lot of times, a lot of my time, I feel, is focused on meeting the needs of people. And when they're in the dying phase and their families are watching their loved ones die, they have a lot of questions that they just haven't thought about on a personal level. And so we approach them on those and help them with their theology and belief practices, and really give them a lot of encouragement that we can, as much as we can.
So if people really are questioning whether or not, let's say in their faith, that there is a heaven, or if they've done everything they needed to do to try to access heaven based on what their faith is saying, those are the kinds of things that you'll actually talk with them about, or allow them to express, or to point out if it's a teaching in the Bible that they're focused on, or whatever, if their faith is something else and they're focused, that you'll actually help sort of find that for them and discuss it and go through. It's really that deep?
Absolutely. We go as deep as the patient or family member wants to go. Some patients will only want to be very surface, very minimally. They don't want to go as deep as other people do. And so we meet the patient where they are, the family member where they are. And so I've gone down as deep as one can go with patients as far as expressing a lot of passion or anger or frustration or joy. And so we go the breadth of spectrum, as you could imagine, of feelings and emotions, as well as probing questions. And then sometimes people just want to know that they're cared for, that they're loved, and that there's a God in heaven that loves them. And so we encourage them through what they've experienced, through what we've experienced through the Bible, through what their family is familiar with. And I really try to grab the family and bring them closer together during this time, instead of splintering apart, which sometimes happens.
Right.
And so our job is to help the family find comfort and encouragement in their faith, in addition to some of the other things that we do as chaplains.
Now, what about situations which could occur, I would imagine, where maybe the family members are not kind of allowing the person to express how they're feeling, or the transition that they're going through, or the fact that they do have this strong faith and what that means and where they want to move with that? If they ask you as chaplain to talk with their family, to kind of give them a better understanding of where they are and maybe what they really need to do, can you do that?
Oh, absolutely. If the patient asks us to talk to the family and express some things to them, absolutely we do that. We work hand in hand with the social workers as well as the nurse and aides, and all the team members come together, and they'll pick up on little things during the visits that other team members won't. And so we try to collaborate and make it a full team effort, really. I'll do that often, what you mentioned. Patient will tell me something, and then I'll relay that to the family. And when they have that sense that things are all in order and everything's at peace, that is a great accomplishment in helping them to be at peace in this process and to gain meaning and have quality of life.
Now, you of course deal with children as well through the
Yes.
hospice process. It's not just adults. Sometimes we think it's only adults, but there's also children that are in those terminal phases. Do you reach out if the family asks you to do that to that school community, because this is a child that is maybe at this point unable to go to school, or maybe say they still are, but their classmates may not quite understand or kind of don't know how to support them? If the family asks you to go that far in terms of into the school community and the classroom, of course talking with the teacher and principal to set that up, do you do that?
I personally would. I haven't had that come across yet, but I would absolutely work with the social workers, and we would go into the school and talk to the principal and see how we can best be of help. Because there might be schoolmates, like you mentioned, that are having a tough time. And certainly if the school doesn't have a counselor available, social worker and myself would absolutely be willing to go in there and help out any way we can.
Okay, well thank you so much. I know that was pretty fast and furious, but you gave us a really good understanding of just how deep and how much of an asset having a chaplain can be, no matter what your faith is in these difficult times. Thank you so much.
Absolutely. Thank you.
Please stay with us. We'll be right back.